Good afternoon and thank you for joining us. We're delighted to welcome Ahmad Ma'ali, the CEO of St John Eye Hospital Group, as our guest speaker for this evening's Guild presentation. Ahmad has kindly agreed to give a hospital and COVID update and illustrate the Gift of Sight 2020 online auction pledge items, where there's a chance to sponsor or co-sponsor equipment, procedures, staff or projects relating to our mobile outreach programme. I'd also like to welcome Diana Safier, our Guild coordinator, who's facilitating the Zoom event this afternoon, and will collate any questions that you may wish to put to Ahmad in the Q&A after his talk. There's a chat button at the bottom of your screen where you can type your question, and we'll endeavour to include them all. The Gift of Sight is usually held in Chelsea Town Hall, celebrating the work of St John Eye Hospital Group, but due to COVID this year, we've put the event online. We're so grateful to everybody for taking part, as it's a very different experience than meeting up in person. Thank you to the team at the Guild for staging this event and to everybody for supporting. Particular thanks goes to the Gift of Sight Fair Committee, who have worked hard throughout the year to get this event staged. I'd like to thank the Balfour Project, who have very kindly shared their webinar Zoom feature again, so that we can host this talk with many supporters, including supporters around the world in the St John family. There will be a recording of this talk available after the event, so if your connection drops out for any reason, do email and we can send you a recording. I'd also like to thank the Tamari Foundation for their very generous donation to the Gift of Sight 2020. That's great, and I would like to hand you over to Ahmad Ma'ali, our CEO. Thank you.
Thank you, Georgie and Diana, for inviting me to speak at this very special Gift of Sight virtual meeting fair in 2020. It is very difficult. These are very difficult times, and you know, we would have liked to join you in London, but COVID had other ideas. So I would like to share now my presentation that I will try and give. Here it is. An update on the hospital walk, as well as the hospital walk and the response to COVID-19. Here we are. I think that's the biggest it can go. Well, again, good evening. It is 7 o'clock in Jerusalem, and good afternoon to our supporters in the UK. It is a pleasure to join you this afternoon and tonight to speak about the walk of the eye hospital, the challenges that we have faced, as well as the achievements in 2020 or this year. Now, okay, I thought to start with, maybe it's a good idea just to give our supporters and friends a background to the context in which we function here in Jerusalem. We have become now a group of hospitals and clinics. In Jerusalem, the Mother Hospital, as we all know, was established in 1882. And in the West Bank, we have the Hebron Hospital, which was established in 2005. And after it is a center or a clinic in the north of the West Bank. It was established in 2007. Of course, in the old city where the Order of St. John started some more than 900 years ago, we have re-established a primary care clinic there. In the old city, we have recently established an outreach clinic as well outside the wall for Jerusalemites. And of course, we have the Gaza Hospital. The Gaza Hospital was established in 1992. And again, we have a mobile outreach service that provides eye care to the people living in the West Bank as well as Gaza. Again, COVID-19, the first few cases of COVID-19 were discovered in Israel and the Palestinian areas in February and towards the end of February and also March. Both authorities enforced very strict lockdown measures for almost 8 weeks in March and April. And by mid-May, restrictions were almost lifted, and there was a gradual movement of staff and patients. During these 8 weeks, there were areas that under curfew, people were not able to travel. And as a result of that, many patients were not able to reach the hospital, especially those traveling from the West Bank. We had a second wave in this part of the world before anybody else. So that second wave reached its peak in mid-September, and there was a lockdown for almost 5 weeks, which started at the end of September. Actually, some of the restrictions are still in place until now. To be able to manage the clinical and the financial impact of COVID-19 on the hospital group was a very challenging exercise for all of us at the senior management team, as well as the board as well. So we're in constant discussions and liaison in order to try and offset the impact or the financial impact, especially on the hospital. And I am aware that other hospitals worldwide, eye hospitals especially, they have had reduced activities due to COVID-19. What's special about the eye hospital is that 45% of its running cost, if you like, comes from patient fees, if you like, or from their insurers. To summarize the COVID impact, really, I would like to say that in Jerusalem, we had 2 waves of COVID-19 with almost 13 weeks of lockdown. There was in Jerusalem 20% reduction in outpatient activities, but only 5% reduction in major surgeries. In the West Bank and Gaza hospitals and centers, there was, again, we had 2 waves of COVID-19 and only 1 episode of lockdown in the West Bank and in Gaza, 20% reduction in overall outpatient numbers in the West Bank and Gaza. Now, surgery in Gaza was not affected drastically. I think there was about 5% reduction due to an opening of a second operating theater towards the end of last year. So if you look at the clinical services, from January till September 2020, we treated 73,000 patients. 1/3 of those who we treated were children. We performed 4,000 major site saving eye operations that exclude also minor operations. Again, as I mentioned, we opened the second operating theater towards the end of last year in Gaza, and this has really increased the surgical activities in Gaza this year by 50%, despite the fact that we have COVID-19 lockdown in Gaza as well. So these numbers are slightly less, if you like, than the year before. Having said that, in the last 2 months, and hoping this will continue, this upward trend will continue, we feel that we will reach 110,000 patients towards the end of the year, which will be almost 15 to 17% less than last year. But we also feel that we will perform close to 5,200 major eye operations, which will be about 500 operations less than the year before. As I said, during the first wave of COVID-19, there was some restrictions, movement restrictions. People were not able to travel. And as a result of that, we had to suspend our outreach services for more than 4 weeks. Following which, we have worked with both Israeli authorities and Palestinian authorities to ensure safe passage of our staff as well as patients. And we resumed outreach activities. The second lockdown, we continued to operate the outreach, taking into consideration all the safety measures in the community. And as a result of lobbying with our donors, we have been able to resume our Gaza outreach work starting October this year. These, I mean, some of you might have seen this in our Jerusalem scenes. On the right-hand side of the screen, we see the Gaza Strip. And this strip of land, we visit 11 places in Gaza as part of our outreach program. On the left-hand side is an enlarged West Bank with small black dots or crosses, if you like. These are the 370 plus places that we try and visit every year using the mobile outreach services. It's very important to say that we mainly visit refugee camps and places in Jordan Valley where people have little access to eye care. Inaccessibility to eye care can be a result of not only barriers, but also it could be a result of financial barriers, not physical barriers only, can be financial barriers, as well as lack of knowledge. And so the outreach team, when they visit people in their refugee camps and small villages, they are more likely to seek eye care, especially if it is free of charge and it reaches their doorsteps. Another slide showing our general doctors and one of the nurses examining patients in a school. I mean, we don't have a static place where we go to. We usually go to places where there is a community leader who will organize a place for us to set up the clinic, and it happened to be in one of the schools or you know, women centers sometimes. So far this year, we have managed to treat 5,000 patients in the outreach, despite all the disruption to the services and lack of access due to COVID-19. 70% of those who we have screened or treated were either women or children. And we remain to be the only community eye care provider, especially during the lockdown, when most of the clinics will be locked or closed. We have obtained permits from the Palestinian Authority as well as the Israeli Authority to travel to places beyond the separation wall and in the areas of Jordan Valley, where we were able to provide very much needed eye care. This graph shows the statistics for the outreach from 2010 till 2019. And we can see the increase in the number of patients we have been seeing, or we have seen. And for example, in 2018, we treated close to, actually more than 35,000 patients on outreach. At that time, we had 2 mobile outreach teams or services running in the West Bank and 1 full-time team in Gaza. In 2019, we lost one of our teams in the West Bank, and we continued with 1 team in the West Bank and 1 team in Gaza. As a result of that, we treated close to 20,000 or 18,000 patients in the patient seen last year. This year, I don't think we will reach that figure. The reason for that is, again, is the lockdown. We have only 1 team in the West Bank, and the team in Gaza, the activities was suspended due to funding problems, and we only have been able to resume activities in the West Bank, in Gaza, at the end of October. So I expect around 10 to 12,000 patients will be treated as a result of the outreach activities in the West Bank and in Gaza. This is a very sad story, actually, and it really shows the importance of the outreach services. We came across this young lady, then girl, Lena, was 5.5, when we were screening our patients in Gaza, in a Bedouin Gaza community. This girl, unfortunately, was born with glaucoma, which is a disease causes an increased pressure inside the eye, and if untreated, results in damage to the nerve fibers. We unfortunately came across her late, and she is still receiving some treatment. We are very unlikely that we'll be able to sort of save her vision that was lost, if you like. A girl like this with a disease like glaucoma would have been able to live all her life with some good functional vision had she been screened and spotted, if you like, and received simple treatment or surgery. In this case, I think the family did not have the awareness or the know-how to seek eye care, and therefore this girl, unfortunately, has lost most of her sight. Again, looking at the impact of COVID on the hospital financially, this will be only one slide that talks about this. On the pie chart shows the planned budget this year for the hospital, and you can see that we aimed for a zero deficit budget. This was the first time ever that we aimed not to have a deficit towards the end of the year. We thought this would be the year that we would like to raise more funds and increase our patient-related income. The management accounts by the end of September, we have, unfortunately, our inpatient income was reduced by £1 million. Despite that, this still makes 46% of the income that we have generated. Voluntary income, including the income that we receive from our priories, was down by £1.5 million. We have managed to secure other income that made 6% of our budget, operating budget. Like other hospitals, and I think all charities in the world, hard decisions had to be made, and some of it is painful, but these were necessary to take in order to ensure sustainability of the work of the hospital. We have worked really hard on increase our voluntary income in Jerusalem, and we have been successful to a certain extent. And I think it's worth mentioning that as a charity, we spend 93% of what we receive from our supporters, from our voluntary income, on charitable activities, mainly eye care. We also had to reduce our costs in all aspects of the hospital, from water to electricity to supplies. Everything was scrutinized, and we have been successful in doing so. The most painful part of my role this year has been really to reduce payroll costs. We have managed to do that without making too many people, unfortunately, redundant. And there were some people they had to be made redundant. But we tried and spread the pain across the whole group, including myself, whereby we have asked all the staff to take 1 month of leave, unpaid leave, and this was very effective in reducing the financial impact of COVID-19 on the hospital. Some people, as I said, there were not too many, maybe 2 or 3 people lost their jobs. Some contracts were changed from full-time to part-time. But these, again, were decisions that not taken lightly, but we had to do that. And I'm 100% sure other hospitals and other charities around the world have done the same as a result of COVID-19. We have worked really hard to strengthen the liaison with both authorities, the Israelis and Palestinians, to ensure safe passage of patients. Because during the COVID-19, we lost almost 18,000 appointments, patients' appointments. Patients were not able to reach the hospital, and therefore we had to work really hard. And we have managed to increase the numbers coming to the hospital after the lockdown. We have lost, there were about 1,200 surgeries that we have lost, or patients were not able to report to the hospital, and therefore we had to work hard to increase the number of surgeries following the lockdown. And I think we have been able to achieve that really well. And in conclusion, I would just like to say that this COVID-19 or the current situation, it's a world crisis, has impacted the group and has impacted the hospital and its patients, its staff. Despite all of that, we continue to develop our services, our partnerships, whether it is locally or globally. And I feel that we have responded very well to the needs of our patients. Like the rest of the world, we are waiting, hoping not to wait for a second or a third wave of COVID-19. And let's hope that the next few weeks will bring good news, especially with regards to a vaccine. And January or February next year, we will resume activities as normal. And finally, I would just like to thank the Guild and Diana and Georgie for organizing this fantastic gift of sight fair, for their support for the eye hospital, especially the Guild, for so many years. And of course, I'd like to thank our supporters, Guild supporters, and I hope next year, this time, I'll be able to thank you in person once this crisis is over. And meanwhile, please stay safe. Thank you, Georgie. Over to you. I think you are muted, Georgie.
Thank you, Ahmed. That was really fascinating. And thank you to everybody who's posing questions. Lots of questions coming in. We're going to ask the Q&A after we've gone to the auction, I think, which is what we're going to do now. So the Gift of Sight Fair is in 3 parts this year. It's the auction, the fair and the raffle. And tonight the auction finishes at 8 o'clock and the auction's in 2 parts. We've had lots of fabulous items donated by very kind donors, Guild members. So there's a silent auction and you can see this fabulous figure on screen, £25,426, which is made up of bids on auction lots. Everything's donated. I think we've got over 60 items, and also which is what Ahmed's kindly agreed to illustrate now, which is the donate to medical equipment, which is your chance to sponsor, co-sponsor projects, equipment, procedures. And so I'm going to hand over to Diana and Ahmed to go through that now, please.
Thank you, Georgie. Diana?
Yeah, so as Georgie said, we've got 3 ways that you can help out at the moment. I just want to highlight some of the people that have joined us today because we're so lucky. We've got obviously loads of Guild members, Sarah Shilson, who was a past chair of the Guild, and Antonia and Tara Elliott, and a whole bunch of Guild members, Denise McGoran, who used to be former chief surgeon over there. And we've also got Angus Rhodes, who's one of our favorite supporters because he does really crazy things like jump out of planes and running 3 marathons in 3 weeks and so forth. He's on a mission to do the Herculean tasks to fundraise for the eye hospital. So hello, Angus. And we've got Dan Heath also from the Masons. We've got David Verity, our hospitaller. And we've also got Elizabeth Mellows, Guild member and wife of the former Lord Prior. We've got Jean Gooding, who's one of our favorite supporters as well. And we've got Mark Corrith. So we're going to talk about one of our prizes in a bit. So Mark Corrith is here. He's obviously the amazing sculptor who made the Tree of Hope in the Merstan Garden and all of our Swift sculptures that go along with it. Mary Nunn is with us. Mary and David Nunn, some of our amazing supporters in Devon. We've got a really wide range of people who've come along. Tony Bethel, hello Tony, haven't spoken to you in ages. So really, really lovely group of people. I didn't even get a chance to mention all of them. We've got Hookie Walker with us. So I'm really glad that they've had the chance. We've got Paul Herbage as well, and Guy Morton. I can't remember if I've mentioned who I've mentioned now, but loads of amazing people. So we wanted to sort of do a little quick demo and talk through some of the items that are in our auction. People can give in 3 different ways at the moment. They can either bid on our prizes, which is here, bid on auction items, or they can donate to certain medical needs that we have at the moment, or they can shop at the virtual fair. We wanted to make sure that we had a virtual fair in some capacity this year, even though we couldn't have it in person. All of the, you can access all three of these ways on the homepage of our auction site. I'll post the link for those of you who don't have it in the chat box in a bit, but you can access it using any of the emails that you would have got about this event, for example. And then once you get onto this homepage, givergy.uk/St. John auction, you can then click on the homepage to access any one of those. So let's go through, should we go through the medical items first, Ahmed?
Yeah, let's go.
Cool. So if you wouldn't mind.
Okay, the first one is not really a medical item, but it's a general donation. I think what I would like to say here that the hospital running cost, the budget, if you like, it's around £12 million. We generate almost 45% of that from patients or patient insurers. The remaining 55% we make from voluntary income from the priories and other donors. So that's the big general donation. That's the work of the hospital. The second one is the mobile outreach nurse. Basically, the mobile outreach on the team, we have 3 nurses and 1 doctor. The main function of the outreach nurse is really to carry out the assessment for patients, as well as provide teaching and for the patients themselves and for the relatives. And the teaching, or the subject of the teaching, could be not only about eyes, it could be about COVID-19, it could be about general hygiene practices and other things. So they are tasking kind on the outreach. They do a bit more than just putting the drops in the eyes. They do a lot of assessment and as well as teaching for patients and their relatives and support for the doctors. The third item is a phaco pack for cataract surgery. Cataract is the cloudness, if you like, or the opacity of the human lens. With age or with diabetes, this lens becomes opaque, and basically patients start losing their ability to see gradually. Usually in this part of the world is over the age of, maybe people are the age of 55, 60, a lot earlier than Europe. You know, with the technology that we employ in the hospital and we use, we require these phaco packs in order to do the phaco emulsification, which is performing the surgery without sutures. Just like to mention that cataract remains to be the main cause of blindness in the world, but mainly in Palestine and other places as well. So if we move to item number 4, it's the outreach mobile clinic. As I said, the team consists of a doctor and 3 nurses who travel to area C, if you like. This is areas where there is not a lot of medical attention, refugee camps, as well as Jordan Valley. They provide more than eye services. As I said, they provide health promotion and health education to the patients, and they screen for diabetes, screen for glaucoma, and then patients either treated on the site, if you like, those with minor problems, they're given the drops, or they are referred to one of our satellite centers, whether in the north or the south or the main hospital in Jerusalem. To co-sponsor a nurse in Gaza, Fuad Najjar, actually, I met Fuad some 30 years ago at the hospital. He was a staff nurse and I was a student nurse. And then I traveled to England to take further studies. Fuad was in Jerusalem, and then he went back to Gaza. And since then, he has been working at the hospital. He is now the nurse in charge running our hospital in Gaza. In Gaza, we treat something like 45,000 patients, and we reached last year 1,800 major surgeries. I suspect that by 2025, we will be seeing at least 55,000 patients, but we will be performing close to 3,000 major operations with the open of a second theater. The demand there is huge, and Fuad is the most skilled. He's an expert in eye care. He has finished his master's degree in management, and I think he's enrolled in a PhD in nurse management. He's one of the most dedicated, kind people I ever worked with. I'm very proud to have somebody like Fuad on our staff in Gaza. The visual, I think this is the LCD. My picture is
yeah.
Visual
acuity LCD chart.
Yeah, visual acuity LCD chart. Basically, this chart is an electronic chart that helps the nurse, or you can see is an outreach nurse that examines the level of acuity for the vision of each patient that comes to the hospital. This test is very important to ensure that the doctor is able to, or helps the doctor to make diagnosis, and based on the assessment that is done by the nurse. The item number 7 is, this is Khalid Zaiter, by the way, is our outreach coordinator. Has been running for 15 years. And he is examining a patient on the slit lamp. Slit lamp is an equipment machine that is used to examine and treat sometimes, but mainly examine the eye of patients, whether you're looking at the anterior aspect of the eye or looking inside the eye. It's a very important machine, and on daily basis, we treat or we examine and diagnose and sometimes treat about 50 patients on any of these machines. So a slit lamp is really the ABC of ophthalmology. It is used by doctors and sometimes senior nurses to examine patients and to make diagnoses. Slit lamp lid upgrade. This is a new technology whereby instead of using the ordinary bulbs that they are quite expensive actually. So this lid technology, or lid lighting, if you like, for the slit lamp reduces the cost because you don't have to change the bulbs. And also I understand from our medical engineer that it provides better lighting for the doctors to be able to examine all aspects of the eye. Number 9 is the examination couch. I mean, we use these couches both in the emergency departments. We use them also in the recovery room as well to perform minor operations, but mainly in the outpatient department also to perform in the surgical room some minor procedures for patients, especially those performed by our senior nurses. I think this is the last one, is pediatric cataract surgery. So cataract in children can be a result of consanguineous marriage, can be a result of other problems related to inheritance, if you like, hereditary diseases. The problem with cataract, and when a child or an infant is born with a cataract, we must operate on them as soon as possible in order to give them a chance to, for the part of the brain to recognize the light and the picture coming from the eye that's affected. So sometimes we operate on children, infants, 2 months old, 3 months old. I mean, if we can operate on them before, we would like to do that, like if they are 1 month old, but sometimes they are not developed enough for them to undertake to have anesthesia, safe anesthesia. So we usually operate on them before they are 6 months old. And once you remove the cataract and implant a lens, you give these, I mean, of course, they will require rehabilitation, visual rehabilitation, etc. But you give them a chance to lead, to develop normally, have normal education and development, and you really give them a chance to have a normal life.
And I think the stat when I was working in the office was about 1/3 of the patients are children, aren't they? Unlike other eye hospitals in the rest of the world, which has much lower numbers.
Indeed, yes. 1/3 of our patients are children. We perform more cataract surgeries than I would say many hospitals. I mean, maybe David will comment on more fields, but we perform more than many big hospitals, bigger than us around the world, because of the prevalence of these conditions in Palestine, mainly in Gaza. I mean, some of it is due to first cousin marriages, but there are other reasons as well.
Well, thank you for that rundown about all of these. These are all items that, according to Fatih, the medical engineer, are on the urgent list. So they're very much in need now. So any donations towards those would be greatly appreciated, wouldn't they, Ahmed? So
Yes,
now
indeed.
I think for a little bit of some fun things, we could look at some of the prizes. Our star prize has got to be this guitar signed by The Who. Are you a big The Who fan, Ahmed?
Can I pass on this one?
Were they not big in the West Bank? So
no. Well, I mean, I think you are asking the wrong person. That's all. Maybe he's popular.
I'll send you some links.
Please do, yes.
So, but this guitar is absolutely fantastic. Here is the actual guitar, signed by Peter Townsend and Roger Daltrey, who are members of The Who. So there's clearly a bidding war going on here, because we're nearly at 15,000 for that. So that's quite exciting. This one is quite cool. Between us, it says on here that you go to Channel 4 to watch the Channel 4 news being filmed with Jon Snow, when it's actually being filmed again in the studios. And then what they didn't want us to put in writing, but they said was pretty much guaranteed, depending on his schedule, was that you get to go for a drink with him after. So Angus is winning that, but if anyone wants to try to outbid him, that's quite a fun prize. And we said we have Mark Corrith with us. So somewhere here, if I scroll through, we have got his gorgeous sculpture that he, did I miss it?
Back up, yeah.
Yep, there it is. Mark, thank you for designing all this amazing
Swift
for us. So Ahmed, do you want to say a word on our Tree of Hope in the Murstan?
I cannot say anything. Whatever I say won't be good enough. If Mark is there, would Mark be kind to say a few words?
Mark, can I tag you in?
Is he saying yes or saying no?
He's not saying anything. Let's see if he wants to come in.
Yes. Hello.
Hi, Mark.
Hi, Mark.
Great.
Sorry for the ambush and the guerrilla attack, but hello, how are you?
Very well, thank you. And well done for this evening. What a huge effort and success. Thank you. Yes, the Swift is part of the tree that I made in Muristan, which is now flying. These Swifts are flying all over the world, and each one of these Swifts is that message of hope and mutual respect, and it is part of the tree in Jerusalem. So by owning one of these Swifts, you own part of the tree, and you attach yourself forever to that, to the clinic in Muristan. It is, to me, it's just a message that is going to spread right around the world. Anyway, I hope that helps. Bid.
Thank you, Mark. Thank you so much for joining us.
Thank you, Mark. Thank you.
Yeah, so basically that's a great prize. It's on at a great price still, so get to bidding if you want to see that in your home. We've got some amazing giveaways.
Number 11 is interesting, a very generous. So we work with Zaytoon, one of our very regular loyal store holders at the Gift of Sight Fair, and they are a collective, and they very kindly donated 2 olive tree planting kits. So if you bid and you're successful on one of these, you get the gorgeous bottle of olive oil, and then Zaytoon will plant olive trees in their groves, which I think are at Jenin, actually, Ahmed, you might know. I think there are olive groves in Jenin for Zaytoon.
I think they are in the north.
Yes, Georgie. Yes, Jenin is famous for olive trees. Yes.
Yeah, and also Zaytoon are on the fair as well, and I bought a box of goodies this week, so the fair does work. It's my package of everyone's getting olive oil and Zaytoon dates and almonds this year, but I just wanted to mention Zaytoon because that's very kind of them to support us.
Yeah.
And Ottolenghi, moving down to Ottolenghi, that's lovely too.
Yeah, well, I was going to say that some of the prizes, we've got more than one. So the Zaytoon prize, for example, we've got 2 of those. So the 2 highest bidders will win that. Ottolenghi has been super generous, hasn't he, Georgie, this year, and his partner, Sami Tamimi. So we've got 10 of these Jerusalem books available. So that means the top 10 people that bid at whatever price they bid on will receive one of these signed copies of this gorgeous book. If anyone's seen it, it's absolutely beautiful. The photos are amazing. Yeah, so what are your favorite prizes, Georgie?
The Woodchester wine that Mark Cadbury's just outbid me on, we're at number 20. I can actually see the vineyard from my bedroom, so I'm going to have to get back on there after the event. But Mark's been very generous, and he's bidding on all sorts of things. But we're furiously on text saying we've been outbid. It was wonderful. Denise McGorand has donated this dinner for 2 at the RAC Club. That's a really, really generous prize. And Denise has actually got some questions on the chat. Yeah. And you can see lots of lovely names of guild members and KT supporters and
Niall Johnston has been bidding, hasn't he? And he's in the audience. So thank you, Niall. Keep on bidding.
Yeah. And Diana mentioned that we've got trustees here. Guy Morton, one of our trustees here, he's bidding. And we've got a former trustee, Nick Asprey. So welcome to you and thank you for joining us this evening.
And we've got some bids from Victoria Sheffield. She's another former trustee. And I know we've got Thomas Cerruti, who's also a trustee bidding. We've got this Order of St. John silk tie. I'm not even sure if it's available in this country ordinarily, is it, Georgie? So
well, it's a special donation, I think, from the American Priory to the UK Priory, and it was on sale in the shop. And so Lionel Jarvis, the UK Priory, very kindly donated that for our auction. And yeah, it's a very special, I think it's a sort of a small run of specifically designed ties.
And we've got here the tour of Guildhall and lunch in the private club. That's with our trustee, Jamie Ingham Clark. So that's a super fun one. It's just fantastic. Ahmed, what would you be bidding on?
I think the first one, if I'm able to
Drinks
join
with Jon Snow?
Yeah, you remember when you landed me in that one? When I had to double act with Jon Snow.
You did it very well. For those of you who
yes,
remember,
I did. Did I?
It was Mansion House, wasn't it? Mansion House dinner.
Yeah, he was a very nice
fantastic. He's always been a big supporter of St. John, and we're very lucky to have him donate such a prize. So yeah, and we've got some Hani Abbas cartoons. He's a political cartoonist. He's a Palestinian who grew up in Syria. I believe he became a refugee and moved to Geneva, and he's won a fair few prizes, and he's donated 3 very, very cool and very thought-provoking cartoons. Here you can see one of them called Bread. We've got a few cartoons actually here. We've got original Alex sketch. We've got some face masks. I'm quite proud of the face masks because my mum made them and it's her birthday. So
thank you, Crystal. Thank you, Crystal.
And they're made with Palestinian embroidery and symbols and so forth. So yeah, so we've got loads of really, really good prizes. So I'll post a link in the chat box for those of you who haven't had a chance. Those of you that want to get some last minute bids in, it closes at 8 o'clock. So please do get in there and help us reach our target, which Georgie will talk about more. But for now, Ahmed, if you don't mind, I'm going to ask you a couple of questions because we had some really, really interesting questions come
Sure.
in from our audience. So if you just bear with me 1 second. We have got David Verity asks, what is the morale amongst the trainees like at the moment? I believe with regards to COVID and how that's affecting everyone.
Yes, I think the psychological effect of COVID on all of us and the staff and everywhere, it can be sometimes underestimated. I think COVID has affected all of us, including the trainees. They have really worked hard, and David is aware of that during COVID-19, because we had to have people coming and going in certain shifts for a certain number of days, so to avoid, putting so many people on quarantine. Therefore, we had the trainees working almost 2 weeks, each one of them. They have done really a good job. We are rewarding them now, David. Basically, we are a bit more relaxed now, and we are able to ask other doctors to do the clerking of patients. So those who are fourth year, and now we're giving them a reward. They love to operate, so we're giving them more time in theater, and they're enjoying themselves. But I think it's very important that we keep our staff aware, informed of why we make decisions, and how and where and why. So that really has helped the staff to accept some harsh or hard decisions that we had to take. But I think the trainees being very well looked after at the moment. They all have passed their exams, which is really a record. From first time, nobody has failed any of the ICU exam or the Arab League exam. So they're doing very well, David. I want to assure you they are more happy than they were about 3 months ago, because they were only seeing patients. Now they are doing more surgery.
That's fantastic. Can I ask you now a double two-parter kind of question from Denise McGoran,
Sure.
one of our joint favorite people, right?
Oh, absolutely. She is my favorite person.
She's fantastic. Can any of the senior doctors get down to Gaza to operate on difficult cases and teach the young doctors there? And also, have the Gaza patients who've been referred to our Jerusalem hospital been able to get there because of lockdown? So how has it affected travel between?
I think that is really a very good question, pertinent question. Actually, no, we have not been able to send any of our doctors to Gaza for the last 6 months. We rely now on our doctors there. Unfortunately, very few patients, I think maybe one a week, is able to travel from Gaza over to Jerusalem. So COVID-19 has really affected the crossing very much, especially from Gaza. But I mean, our doctors work, as you know, we have good doctors in Gaza, and when they need consultation, they are able to speak to our senior doctors in Jerusalem through video conferencing and discussing cases with them. But the short answer is no, we have not been able to send any doctors or nurses.
We've got a question from Mawia bin Sufyan. He asks, is there any overseas volunteering taking place at the eye hospital and the eye clinics, or due to COVID has this stopped?
Actually, this year we have not received any volunteers due to COVID mainly, but in general, voluntary work at the hospital, as a hospital, usually it involves doctors and other healthcare providers. It's very important that people need to understand that when a doctor is traveling from abroad to come to Jerusalem, they need to obtain all the right licenses to operate in Jerusalem. So Mr. Verity, who is our head of clinical governance, is fully aware of that, and we liaise together in order to ensure that if somebody travels from Australia or from England or from anywhere else, they have the appropriate license in order to have an impact on the work of the hospital. It's easier to have people work in the West Bank, but in general, through COVID-19, and we have not been able to receive and accept. Actually, we didn't have too many inquiries, if you like, because of COVID-19 and travel restrictions.
Well, luckily, you've been very good at training up local doctors, haven't you? So for a long time, we haven't had the same reliance on international doctors, have we? I mean, we've even got a Palestinian CEO now, so that's fortunate.
Well, Diana, I think I might give it a history on this one. I joined the hospital in 1990, and Denise was there. I think most of the doctors, and of course, Dr. Deverity was there. Most of the doctors were I would say, senior doctors were expatriate, they're English, American. So were the senior nurses as well. So somebody had an insight, and they thought they had the vision. I mean, and they decided to train and invest in local people. We have reached a stage where all our senior nurses are very well trained. Some of them trained in England, some of them trained in Israel. The same for the doctors. We have worked really closely with our colleagues on the Israeli side, especially in Hadassah and other hospitals. We have trained our doctors. Because they are our doctors, and I feel they are my doctors, I feel some of them are really as good as most of the doctors in Western countries, and David knows them very well. So yes, I think we have reached a stage where we are able to provide high quality service using our own people, but we always need people to come from outside to give their insight into what's happening. We welcome visitors when they have the right qualifications and the expertise. What we need is people who are able to teach and train, impart knowledge, and provide our doctors with skills, advanced skills they don't have. But yes, I think we've reached. We're very proud that we've reached this stage of expertise, and I feel that our patients receive the best care that is possible in the context within which we function.
Thank you, Ahmed. That's so enlightening to hear that. I'm going to tag in Sarah Shilson because she has her hand up. Sarah, do you want to come in? You're on mute.
Oh, I'm on mute. Hello, can you hear me?
Yes.
Hello, Ahmed. I just wanted to ask you what the reaction was to the presidential election in America.
You mean my reaction or the Palestinian people reaction?
I mean, what's likely to be the impact of Joe Biden being president as opposed to?
I think basically we are happy with the outcome of the presidential election. Let's be honest, because as you know, the current administration has stopped all donations and support to the Palestinian people and to the hospitals as well. So we feel that with the new administration, there is a hope of renewing support, financial and otherwise, to the Palestinian Authority and to East Jerusalem hospitals. So in general, I think we have more hope than we did have before the 3rd of November.
Okay, well, that's good to hear.
Thank you so much for that question, Sarah. I'm going to tag in now Tony Bethel, who's one of our longtime supporters. Hi, Tony. You're on mute as well.
There we go. I should be with you now.
Hi, Tony. We can hear you.
Thank you. Lovely to hear and see so many friends. And greetings from North Derbyshire. One simple question. Have the recent problems with COVID created any problems of supply with you in the hospital or the clinics?
Well, thank you, Tony. It did at the start of the crisis, when the masks were like £2 each, face masks that we bought for almost nothing. So at the beginning of the crisis in March and April, there was a lot of problems with supplies. But we have been able to sort of to work with the Red Cross, the World Health Organization, with the authorities. Now we don't have a problem now, or we actually resolved that problem around May time. we have enough supplies now for the next 6 months. But you're right, to start with, we did have problem with especially face masks and alcohol gel and personal protective equipment. We did have a problem to start with. I mean, we didn't have enough supplies that will last us few months, and therefore we were then we were panicking. But then the problem soon was resolved. Now we've learned our lessons, and we have supplies that should last us at least 6 months. Thank you, Tony.
Thank you so much for that question, Tony. Lovely to have you join us. Right, Ahmed, I'm going to ask you our last question. I'm going to share the screen for this and for Georgie's closing comments. I'm really pleased to show you.
Oh, yeah.
No, look, so while we've been talking, it's gone up about 2,000.
Oh, well,
Thank you, everyone.
Oh, thank
Brilliant.
you.
So my last question to you, Ahmed, before Georgie steps in, is say one of our audience members is thinking of making a donation and they want to pick one of these items. Which one should they go for if they're totally undecided?
Well, I think all of these items are very important. And if you ask me which one would be most needed, I think it will be the slit lamp, because this piece of equipment that we use all the time, and we need it all the time, and it's used for as I said, to examine patients and on outreach and in the hospital. And oh, that's Denise Magorian.
Look at Denise.
I think that must be Professor
Tony Tyers?
No, I think this.
Oh, Saul Marin?
I think that must be Saul Marin, but if I'm wrong, Denise will correct me now.
Denise,
when he was young.
Lovely photo of Denise.
I know, fantastic.
Absolutely. She still look the same, actually, I must say.
Yes.
So Georgie, that's me. I've asked all the questions, so over to you.
Well, that was fantastic. Thank you so much, Deanna, for running the Q&A, and thank you, Ahmed. And yeah, there are lots of lovely, very positive comments and thanks on the chat. And David Verity mentioned that the US aid budget that was cut might be restored back on the table with Biden and Harris. So that's really something positive I know that people are talking about. A huge thank you to Ahmed today and to Deanna, to everybody for joining. It's been very kind of everybody to come online, to give up an hour on a Saturday evening to join us. And thank you very much again for supporting the Gift of Sight, and for looking at the auction site and maybe doing your shopping on Brilliant Little Brands. Thank you from everybody on the Guild, very much a team effort to put on all of the Guild events, and thank you everybody for joining us online. It's different, but it's great to talk to people all around the world and be able to get people talking. I don't know how Deanna does that, actually gets factors people in or dials people in, but a huge thank you to everybody this evening, and best wishes from everybody on the Guild and St John of Jerusalem Eye Hospital Group.
Thank you, Georgie.
Good night. Bye.